Welcome everybody to this latest episode of the Workers' Party podcast. Today we're discussing the slow motion privatisation of the NHS. We're very lucky to have with us Bob Gill, Britain's probably most indefatigable and well-known campaigning GP, certainly the most incorruptible of the campaigning GPs I've ever seen, and Liam Stowell, who's a Workers' Party activist and also a mental health nurse. So thank you very much, both of you, for joining us. And I just want to very quickly start with a small overview. You know, we look at NHS privatisation. It's not a new phenomenon. You know, how did we get here? A lot of people are surprised when they start to find out, you know, how bad things have got. And it's been going on under their nose for such a long time, and they hadn't realised it. When in fact the process of privatising our health service really started several decades ago. And it's a process that's been slowly accelerating over that time. And one thing I think we really need to understand about that process is that it's a ruling class project. There is a consensus across our ruling class that free health provision should be dismantled and turned into a for-profit service. And this is not a party political project. And you can see that because privatisation really has continued and accelerated like relentlessly under the supervision of all three of the major capitalist political parties. Tory, Labour, and even Lib Dem have all been in government through this process. And there was no slowing or reversing of anything that had been done by previous governments. Anytime a new government came in, quite the reverse. So I guess that's really the first question I'd like to open up to our panelists is, you know, how have Labour and Tory kind of worked together over the years to advance this privatisation project? And I'll go to Bob first.
Thank you, Joti. Yes, so it would be impossible without a cross-party consensus. Labour had 13 years from 97 to 2010 to reverse what Major and Thatcher had done, which was to outsource ancillary services, bring in a purchaser-provider split within the NHS, bring in a managerialism, a commercial ethos to the NHS. But rather than reversing any of that, they doubled down. And, you know, for the first time in the NHS's history, we had outsourcing of clinical services in 2000 with the Concord Act with the private sector. The narrative was our friends in the private sector are just temporarily helping us out to get waiting lists down. But we know that was just a plausible lie to feed the public. The other massive progression, well, Labour got away with more damage to the NHS because they relied on their reputation as a party that created the health service. What they did was saddle the NHS estate with private finance initiative debt. That was a very clever mechanism. Not only do you transfer ownership to the private sector, you also create a financial time bomb, which is then used to further cut back the NHS capacity because we can't afford all these services because we have to service the PFI debt. And they vastly expanded the managerial and administrative layers within the NHS that are required to run the market. So Labour did a hell of a lot of damage. And, you know, as they left office, it was handed over back to the Conservative Liberal Democrat coalition, who in 2012 made the internal market, which was a phony market to normalize this sort of buying and selling of services and change the culture of the NHS. That was converted to a full compulsory external market. So everything that the NHS does had to be put out to tender. And now, a decade later on, we have the final nail in the coffin, which is the Health and Care Bill, currently before Parliament, which will turn the NHS into a logo and a funding stream, the equivalent of the American Medicare, Medicaid system. So you will have taxpayer-funded services that will diminish in range and comprehensiveness, and more services will be totally withdrawn. So you'll have a postcode lottery. And for those services no longer provided by the NHS, either you go without, or you buy top-up insurance, or you pay out of pocket. And that's on the back of, a cost of living crisis that we're currently living through. So I think all three parties have been directly involved in this gross betrayal of the public interest.
Thanks, Bob. And I must recommend at this point our viewers and listeners who haven't already seen it and aren't aware of it, Bob's fantastic film, The Great NHS Heist, which really goes in more detail into the topic of the process of how the NHS has been privatised, and is really, really important viewing, and something that you should not only watch, but then share with everyone you know, because it's a really important tool in helping to wake people up. Liam, what's your thoughts on that, the way that Labour and Tory have worked together over these years?
Yeah, and I think we've seen it without a doubt in the mental health industry. And the reason I call it an industry is that's what it's become. It's almost no longer a service. It's very much that capitalist idea of how we understand people. And in particular, the New Labour's Tony Blair's flagship mental health thing was the IAPT model, which is the improving access to psychological therapies, which on the face of it for many people was seen as this amazing thing of which more people are getting this counselling type support. But when you look more into it, that it's far from the case. Its model is around getting people back to work rather than improving someone's mental health. And it was almost to prove that people could work, so then they could cut their benefits. And that was one of the main things that come with it. It's a time limited intervention, and of which if you dare not to be better by the end of it, it's on you. It's nothing to do with our interventions or our services. And that's difficult when we're dealing with human beings, of why and how should you get better within 6 weeks or 12 weeks if you're very lucky. I think they're some of the difficulties, and the whole point of the service, to go back to what Bob was saying, it's that managerialisation of mental health of people as well. So rather than understanding what's happened to them, they were understood in data terms. So you would fill out questionnaires and you would be given a figure of whether you were ill or not ill. Nothing to do with any experience or objectivity or anything that we were taught to how to assess people's mental health. It's based on a tick sheet. And so that gives an idea of where it's becoming. So this helped the privatisation, because private services are much better at collating this data than NHS services. So when you compare the two, and when it goes out to those 10-year, well, actually, the private companies can prove, actually, we've got data which shows people are getting better, regardless of outcomes, regardless of research, regardless of whether people are actually feeling better. We have the numbers. Plus NHS, because of the layers of bureaucracy and everything else that comes with it, find it very difficult to gather this data. And actually, rightly so, there's people that fight against it because we want to deal with the human aspect of it. So, but then that almost comes at our own detriment as well. But it's been used as almost something to beat us with, because we're not able to maintain that. So people, say, are understood in these number terms rather than anything that's happened to them or anything around their personality. It completely removes the individualization of people.
Thanks, Liam. I mean, it's interesting you bring up this question of kind of tick boxization of our services, because you're seeing this in all across the public sphere, aren't you? It's very noticeable in schools. If you have kids who go to school, the way that they have, as part of academization and trying to turn schools like hospitals into business units, you have this thing of standards, things that they're measured on and have to keep numbers on, and formulas they have to follow, so that even head teachers are left with almost no kind of room for making a decision based on their knowledge and experience. Everything's down to computer says yes or computer says no. Your son's off for a little while with COVID at the wrong point in the term, and then their stats have dipped below the right number, and you get a call from the attendance officer, even though both of you know that why they've just been off. Like, there's no one's allowed to make a decision anymore, are they?
And those statistics are used to, like you say, that they use it not even to understand services or understand it's to give them cuts. So they will give a figure which is based on nothing. The A&E 4-hour target is the prime example of that, which was obviously introduced in the new Labour. It was based on, I think, one paper, which was, you know, not great evidence based at best. And it was used to basically, once again, beat A&E because it wasn't based on any clinical need whatsoever. It wasn't based on any sort of people that were within practice. It was set up because knowing that most A&E departments wouldn't be able to meet it, especially in smaller towns and things like that. So then inevitably they weren't meeting the target. So then they got fined. And it seems like a very bizarre way to improve services, doesn't it? So if you are failing at this target we've decided to introduce, how are you going to get better? Well, we'll give you less money. So on earth can you get better when you've got even less resources than we already had? It's just farcical.
It's an incentive to lie as well, isn't it? Bob, I think you've had some experience of all this sort of thing.
Yeah, so, you know, the motivation behind all this data collection and league tables and all the rest of it, these protocols, is not to improve the service. It's to generate material to justify your restructuring and your cuts. So it can become a perverse incentive. It can lead to gaming of the system. For example, the 4-hour A&E wait. What people were doing is relabeling cupboards as hospital beds so they could allocate patients to these cupboards, right? Just so they could fiddle the figures and get the targets or avoid the fines. So it's a mechanism of undermining the NHS. It also, all this bureaucratization hasn't led to efficiency. It's draining away at least 10% of the NHS budget. Now, the whole of general practice, the whole of primary care costs less than 10% of the NHS's budget. If you got rid of all that bureaucracy, you would be able to double primary care overnight. So it's a huge waste. It's demoralizing the staff. It wastes a lot of time and energy, and it gives power to the administrators and the managers who use it against the NHS. So it's very perverse and corrupting.
Thanks, Bob. And that brings me really nicely, I think, to the next question I had for you guys. Because something that's frustrated me as a watcher of, and a kind of aware watcher of the process of privatisation for some time, and seeing how the NHS is gradually being transformed, as you said, Bob, so sort of poetically, if you like, as a logo with a funding stream, and I saw the same thing happening at the BBC when I used to work there, is that we continue to have this call from all sides, and I've heard Theresa May say it, and I've heard Jeremy Corbyn say it, more money for the NHS. And I'd really like you to explain to people why this is the wrong demand and how misleading it is.
Yeah, the equivalent analogy is to say to the man who's wasting away with a tapeworm infestation that the cure is to keep feeding him. The NHS, body of the NHS, is infested with tapeworms in the form of managers and administrators. We have the toxic private finance initiative debt. So you've got these mechanisms to withdraw and waste resource. So to pour more money into a system that is infested, as I described, doesn't make any sense without first treating the tapeworm. You have to get rid of the tapeworm. So we need legislation to undo the burden of PFI debt, for example. We need to renationalize the NHS and get rid of the market administration and the bureaucracy. Now that will immediately liberate a lot of resource. The NHS, the way it's run at the moment, it's overstretched. It is leading to a greater cost because if you deal with people early on in their illness, it will be a lot cheaper. But if you have somebody who's seriously ill who goes to an overstretched A&E, gets sent home inappropriately, and then presents far sicker than when they were initially, that person may take a lot longer time to recover. So the system is running in an extremely wasteful manner at the moment, and more money is not the solution. But you're right, this is music to the ears of the privatization lobby, because that's exactly what they want. And this money is going through their hands. So they would love the opportunity to be able to siphon away billions more.
Absolutely. And that's the thing that's always frustrated me, is listening to these, from every direction, more money, more money. It's like, but for what? It's going straight into the hands of the profiteers. And you're just demanding that they should have some more. What you're not setting out any framework by which anything would improve. You know, is it Albert Einstein who said that definition of insanity is to keep doing the same thing and expect different results? You know, we see the budget for the NHS goes up constantly, but the frontline services keep getting worse.
Well, one call for more money that would make sense in the current predicament we're in is money to increase the wages of the staff, right? So you'll keep hold of staff, you'll keep hold of experienced staff, you'll prevent the worsening of the recruitment and retention problem that the NHS has. But more money without any clarity of where this money is going is totally self-harming.
Absolutely. Liam.
And it's the same in mental health. We have more mental health services than we've ever had before, but we have worse outcomes. And we're getting more money, but all that leads to is more services, which means we have more mental health patients. If we're not dealing with the causes of this sort of emotional distress or mental health things, then it's a complete waste of time, because, like I say, we can have as many services as you want, but we don't have the staff to staff them. And at the same time, you're dealing with the wrong end of things. So it's a pointless thing, and it's just going to maintain this crisis, because inevitably all it does is it means more things become the issue, and then probably the problem of health, because inevitably health services are the only thing that people can go to. When there's nothing else left, it's just about, well, there is still an A&E department. So we end up taking on more than what we're capable to deal with, and this is probably a very conscious and malicious thing that's been done by Labour, Lib Dem, and the Tory party, where it's to overwhelm a system to create issues which aren't just health, and that's all that's left. So it's very then difficult. So we have more money, but it's meaningless, because it's not going to the people that need it, and it's not going to the right things. If someone is feeling highly depressed because, let's say, that the fuel prices have significantly rise, heating prices have gone up, food prices have gone up, VAT, you name it. Well, if all we have to offer is 6 sessions or some medication, it's not going to resolve that issue, is it? But actually, that's then where the funding goes to. Say we have more money, then it just goes to the pharmaceutical industry, or it goes to some other form of kits. It's not going into people's pockets to try and help or try and relieve any of that distress that they're suffering from.
So in fact, the distress becomes fuel for some corporation to make a profit, rather than having a health service that's actually aimed at helping, or a general social system that's aiming to, help people in their problems. But of course, we live under capitalism, don't we? And it's not possible for the capitalists to solve the problems of people's, social inequality and poverty and unemployment and all the rest of it.
But it's the irony that they say there's more money, but there's not more beds. So we think, where's the money going to? In the acute sector, it's been, I think there's something like 13,000 beds that's been cut. In mental health, we've had the same. We've had 25% cut over the past 10 years. And the mental health bed cuts came from a good place within the mental health sector, in terms of wanting to keep people within the community. When the community is not set up to help people there, once again, I think this is very much known, then you're left with people who, it is literally life and death. We have an increase in suicides, and it's going steadily up, as it did under Thatcher in the 80s as well. Like, there is no coincidence of the governments that it increases under.
Absolutely. And I guess that brings us onto another question I wanted to raise with you guys, which is really what you think is at the root of the mental health crisis we're facing right now. And again, is it just a question that we need more resources to tackle that crisis, or are there other things which are really needed? I guess, Liam, you were starting to answer that already.
Yeah, it's a thing that I get torn between, because I think we often talk about this mental health crisis, which almost seems like we're in a mental health crisis, And it becomes this almost self-fulfilling prophecy where everyone, it encourages that self-reflection to think there is something wrong with you. And it stops the looking out of the wider society to think, well, actually, there's a lot of things that are broken around me as well, because it just embeds the problem within you. And that goes back to this almost, the neoliberalism that's happened over decades. It's sort of seen very much within you, and you have to work harder to get it, to make you feel better, or to get to where you need to be. And that, for me, is a totally wrong way to go about it, because unless we have support from many different angles, food, housing, education, we could go on forever and ever in terms of the things that have been cut and decimated over, way beyond my time. We're talking last 30 years or plus, aren't we? So these are some of the issues that we have, and we end up in this mental health crisis, of which, similar to what we're saying, a lot of them things come under health, and health are very ill-equipped to deal with these things. I work within children's services, and I think children have very much been, screwed over for years and years. They don't really have a voice. They can't vote. They don't pay taxes, so they're just ignored. And children's mental health services are pretty much a product of that, of which children just get dictated to. The last 2 years they've been in school, out of school. They've had no routine whatsoever. They're constantly, the news constantly portrays just death constantly. So this fear of caregivers and people around them is there. And you think of the news at the moment, we've got 24 hours a day. You can catch up on war. Do you know what I mean? That's terrifying for anybody, never mind a child which doesn't really understand the nuances of Crimean politics. Do you know what I mean? They just see death because they see in those simplistic terms. And that becomes very anxiety provoking. It's very fearful. But how can we resolve that within a local mental health service? Because that's not going away. So it almost becomes this impossible task, and inevitably, because we got into this, we're good people, and we want to try and help. So sometimes we do things to try and help, but it's then becomes overwhelming for us, and we're just constantly fighting against the tide. Then, so yeah, it becomes really difficult, because that sort of is some of the reasons why we're in this crisis. And then we have people, for instance, Prince William and Harry, sort of promoting their own mental health. And I'm not sort of dismissing anything with what's happened or how they feel, but it's just not equatable to other people either, in terms of, their support mechanisms, their support systems as well. So to try and say their thing is the same, I think is quite offensive to people, to be honest. And then you think of, well, you look deeper into it as well. So their charity that was set up was funded by Virgin Care. And you think they have been the main proprietors of health services, and particularly children's mental health services, over the past 10 years as well. So you don't really have to look much further. And now you don't even have to hide it, do they? It's open, it's out there. There isn't even any shame attached to it anymore. There's just almost an acceptance that services are being bought by private companies, and people are okay with it, and they shouldn't be.
Quite a pernicious message, that, isn't it, that you've drawn attention to, Liam? This thing, and capitalism, of course, really encourages us to make social problems, to internalize them and make them into our individual problem. There's something wrong with me, that's why I feel so bad. And to imagine that we're the only ones responding like that, although we're surrounded by people who are also alienated, isolated from this problem of, piling stress on stress on stress, and fracture of communities, so that you don't have human support. And then instead of having friends to talk to and, support of all kinds that you need to get you through a crisis, you kind of face it on your own, and the best you can hope for is to talk to, like you say, a stranger for 6 sessions who doesn't really have what's needed to sort of touch the sides. And their best hope is this kind of sticking plaster on a gaping wound, is it? Their best hope is to give you a few sort of strategies to sort of not completely go under in the face of this overwhelming cascade of problems that are being thrown at people. Bob.
I think, the society we live in, materialism, the state that the working classes are in, job insecurity, low wages, high cost of rent. It's no surprise that there's an explosion of mental health problems, but this is a normal reaction to the circumstances people find themselves in. But the governments do nothing to address the circumstances. In fact, they double down on worsening people's conditions. So they're raising people's expectations. We welcome attempts to destigmatize mental health problems, but to present it as, there's the help is available and it's high quality, that's a total nonsense. We know that it's low quality, temporary, and doesn't fix the underlying causes. So, I think it's a form of abuse, setting people up to fail, expecting that the NHS can fix their mental health. And I agree with you, this is individualizing problems that are societal and have been created by neoliberal policies over the last 40 years.
Thanks, Bob. You put me in mind of something I was reading recently. There's a book by Johann Hari, and he's by no means a socialist. In fact, I say he's quite an anti-communist when you read anything he's written. But he wrote a very good book recently called Stolen Focus. And he's looking at why it is that we have this, such a kind of breakdown in our ability to sort of focus meaningfully on anything. And, he identifies a whole load of issues, but fundamentally, he comes to quite a socialist position. Of course, he can't express it that way because he's not a socialist. So he hopes that you can fix these things under capitalism, and he comes up with examples of how people have done it before. But he identifies totally that these are social problems, and that all the things you do as an individual are just kind of batting away the worst effects, but fundamentally won't fix the underlying problem. And the only way to fix the underlying problem is together. And he talks about this issue, and particularly and he identifies the problem of being working class and being told by someone who's got lots of resources, oh, you need to do this or you need to do that. And he calls it a kind of cruel optimism, that you're holding out to people there's an individual solution when really there isn't. And particularly when you're in a poor working class background where you don't have the time, the resources, the ability to step out in the way that more privileged people can. And exactly that, I think you're right, Bob, to say it is in fact a form of abuse to hold in front of people the kind of chimera of their cure. If you just do this and this and implement these strategies, your life will be happy and wonderful. And of course, we do need to try and find ways to survive in this present situation. We don't all want to go under. We want to keep our ability to function and fight back. But we also have to recognize that it's the real solutions are collective solutions. It's a social problem that needs a social solution. And that's missing from every conversation you ever see about mental health. And that's why I really always appreciate your input, Liam, is that you're one of the few people who works in mental health I've ever heard actually say that, it's a social problem.
Yeah, and you think that the richest and the capitalist countries tend to have the worst mental health outcomes. And this is the sort of irony within mental health, that we know that the outcomes are getting worse because even our own research says it is. So we just put more money into doing the same thing. I think if we had, cancer wards where more people were dying, I'd like to think still people would look at it and they'd probably get shut down fairly quickly, potentially. But with mental health, we just do more of it. So it's a really sort of strange dichotomy that we have. So there was a really good book called Bad in America by Robert Whitaker, and he was a journalist over there, and he was looking at some of the outcomes, and he found that Nigeria at the time, and I think this was the 80s, early 90s, had much better outcomes for patients that had a diagnosis of schizophrenia than the US and the UK. And when it came down to it, it's because they couldn't actually afford the medication, so they weren't able to medicate people. But actually, the community supported them because that's what they had to do, and they had better outcomes. So obviously, then there was a push to go give them the drugs afterwards quite quickly. But I think that sort of, exemplifies what I'm trying to say, that, there's a lot of things that go on in the mental health industry. And, like I said, I've read the book by John Harry as well. And I said that there is some really good things in there. And it's the sort of corruption within the sort of lobbyists from the pharmaceutical industry there as well that sort of perpetuate the crisis. So, for example, I'm sure Bob will be aware of the GAD and the other form that gets done, the PHQ. So that's what tends to be given to GPs, and that was, so they were done by Pfizer, and out of the goodness of their heart, or not, they were given to all GPs for free. Because if you score so high on that, that's allegedly an indication for medication. And obviously they are the biggest providers of anti-anxiety and antidepressant medication. So it's no coincidence that they gave this to the NHS, because obviously we're not allowed yet to advertise medication, but we are allowed in the UK to advertise illness. And so that's why we have, I believe, a lot of these campaigns where we raise awareness of illness. And it doesn't, I don't believe it has destigmatized anything. It's just maintained people thinking or believing they're unwell. And once again, it keeps it within the individual. And obviously there is a lot of people who are suffering. So it's not to dismiss that for 1 second, but it maintains some of these things and stops people looking out of themselves, because it stops people looking at society. They just think about those individual problems.
Yeah, it helps the establishment pretend they care, right? Whilst doing nothing to address the underlying issues.
And it's really noticeable, isn't it, that instead of taking some kind of initiative back into our own hands to rebuild community and give ourselves that's the kind of social roots that we clearly desperately lacking right now, we're just, we're getting medicalized, and everything is pharmaceutical kind of based in terms of the lead treatment for everything seems to be pharmaceuticals, and never mind the long-term consequences of that.
It's like the capitalist thing. It's the market is a very abstract thing of which people can't really understand, and it's almost similar within the sort of the mental health as well. Sort of anxiety or depression is an abstract concept which becomes then tangible within you, even though it doesn't exist from a physiological point of view, because we can't do a test for it. So but then that has control of you, because you don't really understand it. So there's that sort of separation where you say, I have anxiety rather than I feel anxious. So then that has that control rather than you being able to take control of that. And I think that's a key point where people, if we reframe things, it seems very simple, but language has such a power over it. And this has been used time and time again, hasn't it, by capitalists. They understand the power of language to control people.
It's almost as well, it kind of plays into this world we live in of identity politics, which is very much about giving people a label to pin on their jumper and a lifestyle to go with it. And in this case, with anxiety, it's obviously some medication to go with it, and a kind of permanent excuse for kind of being left out of all kinds of things in life, like, oh, you have anxiety, therefore we won't, neither will we try to treat the underlying cause and get rid of your anxiety, nor will we kind of help you to, integrate. We'll use it as a reason for you not integrating, and you'll wear your badge. I have anxiety, and that's your label for life, to, your diagnosis. But I mean, my understanding is anxiety is a symptom, right? And that therefore you want to look at the underlying cause, and if you can address that, the anxiety ought to go down again. But this idea that anxiety becomes a badge that you wear, and kids at school are getting this badge to pin on, and they think that's who they are, and it's a horrible thing to do to people, I think.
Yeah, in terms of how the sort of medical industrial complex can pervert what goes on, we just look at one prime example in America, the OxyContin opioid overdose epidemic. You had a pharmaceutical company pushing a drug which they said was not addictive, clearly was addictive. It's an opiate. Over time, people got hooked on OxyContin. When their life fell apart, they no longer could afford their insurance, or they couldn't get access to the drug. They became reliant on street heroin, and then subsequently end up in overdose and death. Now that episode has claimed so far 500,000 lives in America. And to bring it home, one of the companies who went to the pharmaceutical company, Purdue Pharma, to advise them on how to further maximize profit despite the scandal unfolding was a company called McKinsey. Now, McKinsey are a management consultancy that are central to the NHS privatisation. So these are the people who are shaping our health system in this country. And, you know, death is not a bad thing when there's money to be made.
And I think there is that push within the privatisation, because it's what capitalism does, is it wants to categorise people. So then it's perfect for within the sort of health to start doing that categorisation as well, because that helps with the markets and that privatisation, because it can you fit into a certain group, and that could go in this way, and that in their mind sort of starts doing those sort of funding streams for them. So we can start to essentially becomes ghettoising people as well, and whether that's on race or mental health issues, or like with the oxytocin thing, you'd have, you know, streets and almost villages of people who suffer from addiction together. So you just maintain the problem. So you can move your problem, or what's deemed as problem people, away from, you know, the nicer areas to maintain that capitalism. So you create this underclass of society, don't you? And that's what's happening with the health industry, isn't it? People are getting less and less access to the early intervention type things. So it maintains that crisis because there is no other services there. And the more we go in, like, if your health is not good, then you're going to struggle to do anything else. And so it keeps that underclass of society.
Horrible. Guys, I'm really conscious that in a short podcast, you know, there's so much we could cover to do with the privatisation of healthcare. It's a huge topic, you know, we can't cover the half of it, but I want to ask each of you, you know, is there one thing you'd like, you know, British workers to understand about the crisis in our health service right now? Liam, I'll start with you.
I think I speak from like a mental health point of view. I don't want to oversimplify it, but I think sometimes it's good to have a think. I think I'd like people to get away from the idea of there's something wrong with you, and to think what's happened to you, and then what's happening around you. I think the moment we can start being less sort of introverted and start looking around, I think I'd like to think that will motivate people. You'll start to understand and empathise more with one another, and that can create more of a community and more of a society. Because actually, you'll understand there's so many similarities with your neighbour or with somebody else. Because actually, we all live together. We all have similar experiences. It is all a normal experience because it can be abnormal, otherwise we wouldn't be able to experience it. So I think the moment we can start to think in that manner, I think we'll start being more compassionate to one another, empathise with one another, and we can start to move forward as obviously as a socialist society to help one another.
Thanks, Liam. And it's really important, I think. I mean, I certainly have always found that the best weapon for me when things in life were hard, and, you know, like everybody, I've been through my really rough times, was perspective. That having that bigger picture, being able to see my place in society, you know, and the issue I'm facing in its place, in how it fits socially, is really, really powerful, actually. And I would recommend it to people to be able to step back and take that bigger sort of, you know, historical and social view can really help you to get your sense of overwhelm under control and help you find a way to channel what energy you have in a more kind of productive way. As you say, it's so easy to get caught in the kind of the overwhelm and the navel gaze that amplifies our problems and personalizes them, like you were both talking about. Thanks, Bob.
Yeah, I think one thing I find most frustrating is how docile our unions have been, particularly the health unions. In fact, I'd go further to say they've been co-opted into the NHS privatisation. Certainly, the British Medical Association, the Doctors' Union, has done next to nothing to inform their members and have signed up to the white paper preceding the current health and care bill. There is a group which the health unions have signed up to, called the Social Partnership Forum. And this was cooked up in the mid-2000s with Patricia Hewitt, where the unions effectively say, we will not stop the privatisation. Now, I would love for members of these unions to wake up and start to put pressure on their leaders and say, what are you guys up to? You know, the power of the worker within these organised institutions needs to be called upon to try and fight back and alert the wider public as to what's going on. So, you know, they need to rediscover their true function in life, which is to represent and not sell out their members.
Absolutely. Thanks, Bob. And that's a brilliant place for us to sort of wind up the conversation. I think that it's very easy for us to feel when we're presented with this information and see how far the problem's gone and how sort of passive society seems to be in the face of this huge onslaught of our health provision, to feel powerless and to sort of, oh, what can I do? I'm just an individual. But I really liked, Bob, your analogy of the tapeworm. You know, it is possible for us to starve the tapeworms. It is possible for us to renationalise our health service, to bring everything, the cleaners, all of the services back in-house, to have a service that treats people when they need it, as they need it, to train and value our staff, all the things we've talked about that we know a meaningful health service needs. But it takes organisation. It takes workers understanding that we have power, but our power is not as individuals. It's not in signing petitions and sending emails. It is collective. Our collective power means organising. We can only use our power if we organise to use it. But we can do that. And collectively, we can refuse to cooperate with the sabotage of our services as workers and as patients. And, you know, this is something that's so important, has to be done, I think, is that, you know, really it needs a mass campaign that unites the forces of patients and staff. You know, the question of pay for health workers should concern all of us, not just those who are saying who happen to be employed. You know, it affects all of society, whether or not our health workers are properly paid, properly appreciated, can live their lives, you know, and bring their best selves to work and deliver the best possible service to their patients. That really matters to all of us. It's not a private concern of this or that health worker. You know, I think it's really important that we do everything in our power right now to wake up our fellow workers to the dangers that are facing them, to the realities of the American model. You know, Bob's film is brilliant for showing you what that model is. You can also watch Michael Moore's Sicko. You know, there are lots of, you know, frankly, terrifying portraits of what the future has in store if we don't do something about it. What does the full marketization of our health service look like? How is that going to affect us? I mean, for sure, you know, the mental health crisis is going to take another humongous leap upwards at a point when ordinary working class people find that they can't afford to go to a GP or to get the basic medications that they might need or get any kind of treatment without, you know, bankrupting themselves, which is what happens routinely in the United States. You know, you get the wrong illness at the wrong time in your life and you go bankrupt and you're homeless. You know, this is I mean, you know, you look at the stories of the founding of the NHS and the gratitude that the generation who'd lived before that had to, you know, a doctor come into their house and not charging them because they'd lived at a time where you were terrified of illness because of what it was going to cost you and, you know, not having the wherewithal to pay for treatment. And I think that message that, you know, this has got to be a really serious campaign, and we can't entrust it to professionals, to politicians, to bought-off union leaders, to bought-off campaigning groups, of which I'm afraid there are far too many, to do the job for us. We have to accept responsibility. If we want a health service, we've got to fight for it. But we can fight for it. You know, all we have to do is recognize that the power is in our hands. We have the information, thanks to people like Bob, thanks to people like Liam, we have the information we need. You know, our demands are not immoderate. And the mass of British workers, if they understood the issues, would definitely be on our side. You know, it ought to be the biggest campaign going right now, the campaign to renationalize the NHS. And if it isn't, you know, it's because there's been a campaign to silence and crush the truth about this. And, you know, I was particularly disappointed, and maybe you guys like to come back on this before we close, to see when Jeremy Corbyn was leader of the Labour Party. And there was all this kind of, you know, hope and enthusiasm that he had kind of socialist values and wanted to bring back all the things that are being destroyed. But I noticed that when it came to the NHS, despite the fact that he must have all this information at his fingertips, and he had all those opportunities to talk about it, to talk about what was being done to the NHS at the dispatch box, you know, in Prime Minister's questions, all those, he never took it. In the big rallies I saw him speaking, he just said the same thing Theresa May was saying, more money for the NHS. He never talked about what was being done to the NHS. And I personally was really shocked to see that level of complicity, even from somebody who, you know, was supposed to be a really kind of savior of the working class and of, you know, our socialized services. And that really brought home to me the fact that the Labour Party, even the most left-wing version of the Labour Party, is not going to solve this problem for us, because it's so enmeshed into, you know, the capitalist system, and the capitalists have decided it's going to be privatized. I don't know if you two had any thoughts on that particular aspect. Liam.
Yeah, I think given how much ammunition there was, you know, it was disappointing to see not only the frequency of the discussion, but the level and the depth, given how serious the NHS, the state it was in prior to the pandemic hitting. But compared to his predecessors, you know, there was nothing coming from his predecessors. And I suspect there was a lot of pressure within the right of the Labour Party to keep quiet about the NHS, because look at their record between 97 and 2010, without which we wouldn't be in this situation we're in. So the Labour Party's hands are not clean on this. And until they can recognize the part they played and call it out and say we need to reverse it, then they can't be trusted with the NHS.
Absolutely.
And I think it's endemic in politics, and especially British politics at the moment, to oversimplify everything. So the NHS is simplified to get more money, and Brexit is get Brexit done. It's the fear to actually to converse about it, to talk about it, because they know if we start talking about it, these things will come out. So it keeps it hidden, and I'm sure the pressures were there, and so there's almost that fear of losing power over actually trying to resolve what needs to be done. And I think that was clear with the Corbyn era of Labour time and time again. It happened with the Brexit, didn't it? It happened with the NHS. It ended up becoming similar to when the Lib Dems got in. It just became about power and maintaining that ruling class over working class values and working class needs.
Right. Well, I'd like to thank once again our contributors, Liam and Bob. Thank you ever so much for giving us your time. Thank you to our viewers and our listeners. And for all those of you who are not yet affiliated with or active within the Workers' Party, I would ask you to look at our 10-point programme and think about joining us, because fundamentally, as I said earlier, the power that working people have is together, is in organisation. We in the Workers' Party are absolutely committed to fighting within the current system to renationalise our NHS, and fighting ultimately for a society where all the services that workers need are provided properly, so that we can have a dignified life. We, the people who produce the wealth, should be able to enjoy the fruits of that wealth, rather than seeing it go into the pockets of a tiny few, while those of us, the real wealth creators in society, get poorer and poorer. So thank you once again for joining us. Thank you again to our guests, and see you next time.